Hi everyone. In today's clip, I will talk a little bit about acne. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please make sure to consult your healthcare provider. So, acne is a common skin condition that happens when hair follicles under the skin become clogged. Sebum, or oil, that helps keep skin from drying out, and dead skin cells plug the pores, which leads to outbreaks of lesions. Commonly, we call these pimples or zits. Most often, the outbreaks happen on the face, but it can also appear on the neck, chest, or even shoulder and back. So acne is an inflammatory disorder of the skin, which has sebaceous or oil glands that connects to the hair follicle, which contains a fine hair. In healthy skin, the sebaceous glands make sebum that empties onto the skin surface through the pores, which is the opening of the follicle, in the follicle. Keratinocytes, which is a type of skin cell, line the follicle. Normally, as the body sort of sheds the skin cells, the keratinocytes rise to the surface of the skin. When someone has acne, the hair, sebum, and keratinocyte stick together inside the pore, and this prevents the keratinocyte from shedding and keeps the sebum from reaching the surface of the skin. So the mixture of oil and cells allow bacteria that normally live on the skin to grow in the plugged follicles and cause inflammation, swelling, redness, heat, and even pain. When the wall of the plugged follicle breaks down, it sort of spills the bacteria, skin cells, and sebum into the nearby skin, creating lesions or pimples. For most people, acne tends to go away by the time they reach their 30s. But some people in their 40s and 50s continue to have this skin problem, although it is most common in teens and young adults. We have several types of acne lesions or pimples. Types of acne include whiteheads, which is the plugged hair follicle that stays beneath the skin and produces the white bump. We also have blackheads, which is the plugged follicles that reach the surface of the skin and open up. They look black on the skin surface because the air discolors the sebum, not because they're dirty. So then we have papules, which is the inflamed lesions that usually appear as small pink bumps on the skin and can be tender to the touch. We have pustules, which are papules topped by white or yellow pus-filled lesions that may be red at the base. Then we have nodules, which are large and they're painful solid lesions that are lodged deep within the skin. Severe nodular acne, sometimes called cystic acne, is a deep, painful pus-filled lesion. So acne can be caused by excess or high production of oil in the pores, buildup of dead skin cells in the pores, growth of bacteria in the pore, an increase in androgens, which are the male hormones, male sex hormones during puberty, hormonal changes related to pregnancy, certain medications, such as medications that contain corticosteroids and lithium, diet, stress, pressure from sport helmets, tight clothes, backpacks, environmental irritants like pollutions and high humidity, squeezing or picking at blemishes, scrubbing the skin too hard, and so on. A study was conducted that involved 45 males and 55 females, ranging in ages of 10 to 30, and with various severities. And the patients were given 10 grams of pantothenic acid a day in 4 divided doses. To enhance the effect of that, the patients were also asked to apply a cream consisting of 20% by weight of pantothenic acid to the affected area 4 to 6 times a day. With this treatment regimen, the response was quite impressive. There was a noticeable decrease in sebum secretion on the face, usually 2 to 3 days after initiation of the therapy. After 2 weeks, all existing lesions started to regress, while the rate of eruption of new acne lesions began also to slow down. In patients with severe acne lesions, complete control took over several months, sometimes up to 6 months or longer. In some of these cases, in order to get some immediate response, it was even necessary to sort of step up the dose to 15 to 20 grams a day. In any event, the improvement was a gradual and steady process. With this form of treatment, another remarkable feature was the size of the facial skin pore. The pore size became noticeably smaller within 1 to 2 weeks, very often much sooner, actually. So like sebum excretions, the pores will continue to shrink until the skin becomes much finer, giving the patient a much healthier and beautiful skin. Scrubbing the face regularly with baking soda before moisturizing has also been very helpful. On the metaphysical side, acne can symbolize a barrier to push people away. When the threat of being seen too closely disappears, the acne can heal. So it can be a way of distancing ourselves from others. It can be also aggravated by emotional stress, like embarrassment, grief, fear, frustration, and anxiety. Negative emotions can increase the production and release of histamine, which can contribute to acne as well. So anger is also a common emotion that is linked to acne. And I find it, depending on where on the face it appears, it indicates that it might be directed towards something specific. For example, it's believed that if the acne appears on the right side, it is anger towards a male, or the subject of giving something. It could be whether it's giving money, some possessions, love, or anything. And if it is below the lip line, it's something or someone you consider below your rank. And above your lip line is somebody that you consider above your rank. The same works on the left side, only the left side is female related and it is for receiving instead of giving. Also, sometimes if acne appears on the chin and jawline, this area is most commonly linked to hormonal fluctuation, which can be aggravated by stress and anger, leading to breakouts in this region. If it happens on the forehead, this is often associated with stress, anxiety, digestive issues, which could include feeling of frustration or tension. If it appears on the cheeks, this may indicate issues with the lungs or immune system, potentially linked to feelings of sadness and grief. Hope this has been of some help. Like and follow for more. Be the light.